I'm Dr. Vera Reinstein, and I'm a pharmacist with Alliance Health. In my role, I'm reminded daily that North Carolina is still in the throes of the opioid epidemic, with 6 North Carolinians dying every day from drug overdoses. North Carolina's Prescription Drug Monitoring Program, or PDMP, is the Controlled Substance Reporting System, or CSRS. The CSRS is a powerful tool at your fingertips to help improve opioid safety. In this brief video, I will review a few of the recent CSRS enhancements which can help you use the CSRS as a clinical tool in your pharmacy practice to improve opioid patient safety. Too busy to check the CSRS? Well, it could take just 3 seconds of your time, down from about 4 minutes. The CSRS's new technology platform now enables CSRS integration into electronic health records, including pharmacy management systems. Integration not only saves time, but also eliminates the need for the cumbersome delegation process for support staff, such as pharmacy technicians. The integration process is pretty simple. Please visit the website on the bottom of the slide to receive the Integration Initiative Welcome Packet. Once the CSRS is integrated into your pharmacy software, the default search will include North Carolina's neighboring states of South Carolina, Virginia, and Tennessee, as well as North Carolina. In addition, multiple other states can also be selected to be included in the search, as seen on the slide as of May 14th. Checking Military Health System will search Tricare. The CSRS facilitates safer, higher quality care. When a pharmacist checks a patient's history of dispensed controlled substances before dispensing a controlled substance, they can identify a patient at a higher risk of overdose. Now the pharmacist has created an opportunity for a conversation about care. The CSRS query-generated NARCS report includes a series of type-specific use scores, which include the NARCS scores, the Overdose Risk score, and additional risk indicators. These scores are located in the Risk Indicators section of the report. First, NARCS scores, specific for narcotics, sedatives, and stimulants, range from 0 to 999. Higher NARCS scores indicate higher numbers of prescribers, pharmacies, and overlapping prescriptions, and of course, higher morphine equivalent doses, or MEDs. Next, the Overdose Risk score, or ORS, ranges from 0 to 999. Higher ORS scores indicate an increased risk of unintentional overdose. ORS often correlates with NARCS scores, but not always, since pharmacy use is weighted higher than MEDs. The risk of unintentional overdose death approximately doubles for every 100-point increase in the ORS. It's important to note that previous overdoses would raise scores, but is not currently reflected in the risk score, which is only based on CSRS data. So that's where your conversations with the patient are crucial to identify other risks, like previous overdoses. The CSRS provides the following guidance on using the ORS. For scores up to 440, consider other sources of risk beyond CSRS data. Risk can also include knowledge of previous overdoses, as well as information gleaned through risk screening tools, such as the Opioid Risk School, or ORT, or the ReAssord. Both are reviewed in this webinar series. North Carolina does not currently include prior overdose history in the risk scores. So, if you are aware of a patient's prior overdose, this will significantly raise the overdose risk. With scores of 450 to 650, about 50 MEDs and higher, consider proactive counseling and offering a naloxone prescription. This webinar series also will review the naloxone standing order to improve access to naloxone for high-risk patients. For scores above 650, about 90 MEDs and higher, consider proactively recommending a naloxone prescription, especially if you're aware of a previous overdose. Review use patterns for unsafe conditions. If multiple providers are involved in unsafe prescribing, discuss your concern with the patient and consider contacting other providers directly. If multiple pharmacies are involved in unsafe prescribing, discuss your concern with the patient and consider a referral to a pharmacy lock-in program. If overlapping medications of the same or different type are involved, discuss your concern with the patient and contact the provider to consider tapering to a lower dose and/or discontinuing the potentiating medications. If the patient has evidence of a substance use disorder, consider referring for treatment. To facilitate patient education and referrals for substance use disorder treatment, clicking on the CSRS Resource tab link will provide printable CDC pamphlets. In addition, the CSRS Resource link tab also pre-populates the patient's zip code, which can be edited, in the SAMHSA buprenorphine treatment locator. Selecting Submit will generate a document listing 30 buprenorphine providers that are closest to the patient. The CSRS can do so much more. In the toolbar at the top of the application, you will find many different tutorials, including those providing education as well as information on ongoing CSRS upgrades with new functionalities. I hope this information will help you identify patients at a higher risk for overdose and help start conversations that result in improved opioid safety and improve access to treatment for opioid use disorder if indicated. Thank you for taking the time to watch this video to learn more about the clinical utility of the CSRS for pharmacists.